joins us now on the hotline. And Doc, how are you?
I'm great, gentlemen. How are you?
Fantastic. All right, so we just saw the PGA Championship. We saw a guy that's coming off of knee surgery win it. As far as when you're watching some of these injuries to golfers and their backs and their lower extremities and things like that, why do they get such vicious injuries?
Yeah, any injury at a professional level is a big injury. So if it's a small little strain or strain, if there's a significant physical problem, any injury is a big injury because it takes them out of their comfort zone. What we're looking at, knees, ankles, backs, necks, is repetitive stress, repetitive overuse. So if you think about how often they're hitting balls when they're out in the practice range, how many tournaments they're playing all the time. So if they're running that engine really, really hard, at some point something has to have a mechanical failure. What we want to help them with is a diagnosis. What can we do to try and help them? Because, as you and I have discussed in the past, sometimes there's a surgical option, sometimes it's a conservative treatment, but the diagnosis is key.
When is it time to shut her down? And it's got to be tough for this guy in particular, Brooks Koepka, and because he's trying to fulfill a new humongo contract from the Live Tour. Plus, he's trying to win majors and be back to his number one status. But if he takes any time off, in the world of golf, as you know, like your game could suffer. So for these guys to take time off is a huge sacrifice in their careers. But not doing it, you could be creating an even bigger injury for the future. That's a tough world to balance. Like, when do you think the time is, you know what, we got to shut her down and we got to get right before we can get back out there?
These men and women who play at this level are pros. They know their bodies. They know pretty much what they can tolerate. And I think that there's a fine-tuning element to how they approach their practice and their tournament play. If there's a tweak and they know if they can recover from it, they'll try and play through that discomfort. But they know, and if there's an issue that's really a mechanical problem and they're unable to recover what I call baseline back to their function, they have that opportunity. Your question is a really important one. Is there a time to shut it down, and what's the risk versus reward? They're at a high level. They don't want to shut it down because they're competitive and they're playing well. The risk is that you take a small injury, throw a match on some gasoline, all of a sudden it just burns out of control, and then that's going to take them out of the loop for a bigger time. So it's recovery.
As far as now that it's warm and we're getting out there on the water and things like that, and we're jet skiing and we're we're wakeboarding and doing all kinds of different stuff on the back of boats and things like that. What kind of injuries do you see from out on the ocean and out on the water right now?
You got the water skiing, jet skiing, wakeboarding, windsurfing, kiteboarding, all of the things that are high demand, high pressure points on your body. It's the concept of how far can you stretch that tendon, what can you do for that muscle group, and are you going to suffer some devastating injury? What we see, a lot of shoulders, water skiing in particular, a lot of shoulders. When they're going out on that slalom carve and they're going to hit that buoy, the amount of torque that goes through their shoulder is remarkable. Knees and hips, same concept. Coming into a straight line but then showing some immediate curve increases that contact force. So meniscus, ligaments in knees, shoulder, rotator cuff, and then the suction cup part of the shoulder, labrums for shoulders.
Give us some of your sports background, because we were reading your bio, and it's just littered with a bunch of sports. And I always feel like a guy that has played the sport and knows a little bit about the twists and the angles of things can really talk to you a little bit better about what's going on with yourself.
Yeah, I come from that side of the field. Having been there as an athlete in the past, I've had my own wealth of injuries, too. I was a lacrosse player. Played at a pretty competitive level, soccer player, played at a pretty competitive level. I'm pretty much, you roll a ball out and I want to play. But I've had ACLs in both my knees, 4 surgeries in my knees, ruptured my Achilles playing paddle tennis. So I've been on that side.
Wait, what?
Whoa.
Is that the pickleball?
Yeah, so what that brings to the table is a level of understanding.
Right,
I know where that person is. I know what they've experienced. And we've had this discussion, the mental health side to it, that's something that I can relate to.
All right, so between tennis and pickleball, which injuries are you seeing more of right now?
Pickleball.
Yep.
No doubt, pickleball, and it's taken the country by storm.
Yep.
Everybody is playing pickleball. They're building pickleball arenas and courts. The beauty of pickleball is that it gets an active lifestyle back to someone who may have been out of the loop for a little bit. It's competitive, and it crosses many generations. I'm seeing a ton of I would say masters class athletes who are getting back into a sport that may be a little bit less demanding, pickleball, but you still have to be competitive. They say it's all about the dink, but it is a competitive sport. Lots of knees, lots of ankles, lots of Achilles, and some shoulder. And I think the root cause of that is someone who's been out of the loop for a little bit, wants to get back into a sport, may have to do a preseason to get themselves in that condition.
Well, that's what I was getting at, because I just don't see, like, my daughter plays tennis, and they do a lot of stretching, a lot of cardiovascular stuff, running around, getting in, doing different drills, a lot like basketball. In pickleball, I see a little bit older people playing it. I don't see them stretching a whole lot. I don't see them, like you said, getting prepared to play the sport first.
Yeah, the preseason, stretch, strengthen, cardio. If you come into something cold, you're going to have a tough start through trying to get through that season or that game. The pre-participation approach, working on cardio, working on some fitness. None of us, well, I won't say none of us, very few of us stretch a lot. And stretching, Pilates, yoga, getting that tone back into the muscle tendon unit, making sure you have that range of motion, that's applicable to that type of a sport. So with pickleball, if there's a lateral move, if you have to get out of the kitchen, go to the net, drop back, do something, you need to have already experienced that prior to getting onto the court. Otherwise, your risk level goes up.
Talking to Dr. Waskowitz, orthopedic surgeon from the Bone and Joint Institute, Hartford Healthcare. Can't wait to see you and the rest of the gang out at the Travelers Championship. You guys are going to be giving demos. You're going to be taking gates. You're going to be looking at people's swings, as they're all golf fans and want to be like the pros that are out there. Hope some other people that we see would be Will Zalatoris, Hideki Matsuyama, Brandon Steele, J.B. Holmes, and Lanto Griffin. I mentioned those guys because they're either dealing with a neck or a back situation. And with the twisting motions of golf, I can see how that can be really common. But I think you're going to tell me exactly what you're talking about with pickleball. Those guys need to stretch more before they go out to the tee box.
Yeah, the PGA Championship Series is a phenomenal event. I've been doing it for many years. I'm a site physician at Cromwell, so it's an opportunity for me to see that athlete in a different level when they're coming to you and asking for some guidance. Will Zalatoris, when you have back injuries where he has had disc herniations, underwent a double microdiscectomy to take the pressure off of his nerve root that goes down the leg. If you think of the mechanical side to that, range of motion of the back is forward flexion and extension, but then there's the rotational component. So when you add that variable, that torque component to the lower back, it has to be controlled by a foundation, and the foundation is your core. So all of these individuals, men and women at that level, are working on a core stability program. And that's something that is advisable. Me as a coach, I get my athlete out there. I'm going to say, hey, look, okay, you ready for this? We need to do your pre-workup. Got to work on your core. And that rotational component, if you get a good foundation, that sets the pillar for a stable platform for your lower back. So when you go into that swing mechanics and you're hitting, how many balls are they practicing with and how many tournaments are they going? Yeah. They're running a machine at a high level.
Talking to Dr. Robert Waskowitz, Bone and Joint Institute, Hartford Healthcare, orthopedic surgeon. Wanted to ask you about that. Is the back the toughest thing to come back from, that surgery? Whether you're a golfer or whether you're any athlete, I just know the guys that I've played with that have had herniated discs and back and neck surgery and things like that, they have to do so much more stretching now. They have to do so much more, like you said, core strength and things like that to protect their spine. Is the spine one of the most dangerous and difficult things to operate on?
I think it is, because it's a links in a chain. You got 7 vertebrae in your neck, you got 12 vertebrae in your thorax, you got 5 more vertebrae in your lumbar spine. So you have 24 segments that are connected. Really a complex chain. And if there's a little bit of a variation in that mechanical ability, it literally will throw the wrench in the engine. If a person has enough symptoms and complaints and has failed that conservative approach, modify the activity, maybe consider medication, maybe even go down the road of a cortisone injection. Surgery is really the last resort. You know, we love to be able to fix things, but not everything is surgical. But a back, once you change the anatomy of the back, that's a really hard one to come back from.
I'm really interested in your involvement with the PGA now that you got us started on this. When these guys come to you, because this has got to be different than if you're working for a team. You know, the coach or their trainer might refer them to you. When you're a PGA player, you're an individual personal contractor. You've got no team. You've got nobody to worry about but yourself, and you've got to make that call into going into the training room. What are those conversations like? How does that get started? And, like, do you see anything out there on a course where you can go to a guy and say, you know, I saw this. Are you feeling any pain here? Can you talk to them that way, even though you have no relationship with them other than being on the course?
Yeah, and it's establishing a sense of confidence and a willingness to listen to what their complaints are about. Every time I'm on site, I'm amazed at what the PGA athletic trainers do. They have 2 full trailers out there, 1 treatment, 1 rehab, and these athletes are working with them early morning, late at night. So the athlete knows, that player knows what they need to do to prepare. But the training staff they're really the coaches that help point out, you know, maybe we should work on a little bit more of this rotation in your swing. Let's work on the twist of your shoulders. Hip issues with a golf swing are huge. So the trainer who knows what to push on these individuals can help them. And 1 degree of difference, you guys know this, 1 degree of difference is the difference between first and last.
Absolutely. And Dr. Waskowitz, we had Steph Barassa on here a little earlier, and she talked about, because I know you work with a lot of high schools and colleges around the area, and getting in there for the baseline checkups and things like that to preventative medicine. This is one of the biggest things with Hartford Healthcare and Bone Joint that we love on this show, is that you're trying to get these young athletes in there, male, female, and get a baseline so that, God forbid, they ever do get injured, they have something they can go back and refer to. How huge is that for you as a physician?
It's monumental, and Stephanie's great. I work with her through the Bone and Joint Institute, on research, on what we can do from biomechanics, and getting at an individual at a young phase in their career and seeing if we can work with them. You establish a lifelong relationship with them, because it's not just one and done. If an athlete is playing at a high level, not to be Dr. Doom, but they're going to have an injury at some point. And if you can establish that baseline function, as you alluded to, if you can establish a relationship with them and they trust what you're telling them and they can see results, that's going to set that person up for success. So Steph does a great job. The BJI group is superb. We do a lot of research. So we're really looking at trying to figure out complex problems.
Where's that research gone? I mean, we've been with you guys for 5+ years. You guys have been doing baselines all across this state, and I'm sure you've gathered so much data on what's worked, what hasn't worked in certain situations, on people's age, what they're coming back from. Where has that data kind of led you into some other new areas that have been very successful that you didn't think you'd get before you started baseline testing with all these athletes?
Yeah, we spent a ton of time on concussion, on traumatic brain injury, and recovery platform in order to person to get that return to read, return to learn, return to sport. So there's been a tremendous amount of energy put into finding out baseline studies for traumatic brain injury. The other things that I personally enjoy, working with shoulders, working with knees, ACL injuries, that's a primary passion of mine. So we've done a lot of research in pre-participation physicals, finding out deficits. Do you know how to jump? Do you know how to land? What can we do to work on your mechanics? And then we take that information and try and get 1 or 2 things that we can really drill down on, do the research, maybe even publish, but get that information out there. From the high school perspective, I'm also on the Committee for the Medical Aspect of Sport through the CSMS, and we're working with all the high schools in the state. So it's trying to get information. You can't do anything if you don't have the data. So data collection is something, as you said, takes years and years of work. Then you have to kind of put the puzzle together, and hopefully you come up with something that's usable.
Robert, look forward to seeing you out at the Travelers. Thank you so much for your time.
Privilege. Thank you, guys.
All right, Dr. Robert Waskowitz. If you've got a shoulder or knee problem, he's one of the best in the business, and he's right here in the state of Connecticut. We'll take a quick break. We'll come back, and we'll do the sports menu next.